In March 2020, the term gone viral went from overnight sensation to the unthinkable. The way humans looked at the most common things and gestures changed overnight. Just when people thought that the worst was over, the second wave emerged. If the first wave felt like the virus was distant and aloof, the second wave had it knocking on our own doors. Everyone had or knew someone affected by the virus.
When the second wave hit India, especially the urban areas, we knew we had a window of 2 to 4 weeks before it would hit the rural areas and the small towns, and we wanted to be well prepared. We did a lot of things to be prepared, and by the time it hit the small towns in about 4 weeks' time, we were well organized and prepared to handle the pandemic.
To combat the second wave, NextWealth put together a plan to ensure the safety of all its employees. To begin with, a hub and spoke model was created by setting up a dedicated team under a Chief Pandemic Relief Officer, with its nodal center being the head office. The 6 centers were managed by one center pandemic relief officer, who in turn supervised the activities of several cluster relief officers. Each of the 129 cluster relief officers was in charge of 20 employees who geotagged themselves to enable and ensure the last mile delivery of pandemic relief. In times of crisis, uncertainty and fear prevail, and without strong leadership and strategy, people panic. Awareness was increased by conducting a lot of knowledge dissemination seminars, including sessions with doctors to reiterate COVID-appropriate behavior, improve lung capacity, and clarify doubts and myths, respectively. Through WhatsApp and Telegram channels, the teams at various levels worked in parallel to prevent and proactively ensure that the spread of infection was contained. Empaneled doctors enable online consultation free of cost for employees and their family members. Real-time vaccine availability and additional leave to recover from the effect of vaccinations encouraged employees and their families to take the shot. Employees were constantly updated with active cases, home quarantine status, and recovery status. An extensive database of medical resources like testing centers, hospital beds, medicines, oxygen cylinders, ambulances also helped employees who were looking for ready references. The pandemic relief team extended support 24/7, gathering required information and helped distribute pulse oximeters and oxygen concentrators to those in need. The final or most important step was active intervention. To ensure that people affected by the virus recovered well, additional leaves were sanctioned and doctor consultations were arranged. The patients were also given guidelines to ensure a proper diet and given psychological counseling to ensure holistic support and well-being.
All of us are thinking that the pandemic is over. Nobody is safe until everybody is safe. The only thing which all of us can do is to get vaccinated, including booster shots, wear continuously mask, follow the social distance, and strictly adhere to COVID-appropriate behavior so that all of us can win the war.
As organizations continue to monitor the situation and work out their future strategies within the context of this global health crisis, NextWealth is aware that it is not the time to let our guards down. The past few months have prepared and led us into multiple de-risking initiatives, apart from taking an extremely cautious approach